Hi, I'm Ben, and today we're going to be doing another interview with a frontline worker. I think that these interviews are really important because these frontline workers don't have time to be doing these sort of videos, whereas I have a little bit of time on my hands. All right, let's get right to it. Who are you?
I'm Stephanie Hamilton. I'm a registered nurse at Victoria Hospital, and I work in perioperative care, specifically in the operating room. So everything that I am saying is my own personal thoughts, and I only speak on behalf of myself.
How are you personally feeling about this? That's pretty open-ended. I don't know where you're going to go with this.
I have two. I have a very positive one, and I have one that's more of my concerns. The biggest feeling that I'm having is just overwhelmed. I'm overwhelmed with emotions. I'm anxious. I don't know what to expect. And I'm worried not only for everyone else, I'm worried for myself. I'm worried for my family. I live with my parents. I don't know what I'm bringing home to them. And I feel personally that a lot of nurses are going to be facing what we call a moral dilemma. I joined nursing because I want to help as many people as possible. I want them to get home to their families. I want them to have these long lives, like a quality life. And now we're facing a shortage of PPE, and I don't know if I'm going to be safe at work anymore.
In London, do you think there's going to be enough PPE to go around?
No.
No?
ONA sent out a sheet for us that gave all the different types of N95s, and the one that I personally use is the most common one, and we have a 5-day supply of it.
You have 5-day supply of N95s?
Yeah.
Oh, I did. Okay. I actually didn't think it was that serious, especially in London. I know it's a national problem, but I was thinking that in GTA it would be the big problem, not in London. What?
I am terrified at the thought that we're going to have to start reusing the masks. Even watching in the States how they're putting their N95s into a Ziploc container so they can reuse it the next day. They put the container up to their face, and then they take their straps and pull it over so that it's on the outside of the container, and then put the other strap so that the bottom of the mask is in the container, and then they can take the container and put it up to their face and do it over again. It's very, it's smart if you have to reuse it, but it's crazy that we live in a first world country and the States is a first world country and we have to do this.
I didn't realize that the shortages were that real this fast. Okay. Wow.
And they're asking us to wear a mask for all patients now. So not an N95, but for anyone that's with any patient, they're supposed to be wearing a level 2 mask and above. I hate when people say you signed up for this, because I didn't sign up to not be safe. I did sign up to take care of people and make people healthy, and I want them to live the best life as possible, but I have to be here for that to happen. And not having enough PPE is like sending a police officer out without a bulletproof vest, or sending a soldier out to the front line without a gun. That's what it's feeling like.
With the guarantee of being shot at as well.
Yes.
Because you will literally have these hostiles essentially there coughing.
Yeah, and I'm in the 2 meters. I can't social distance from my patients. I am right there with them. I'm going to hold their hand. I'm going to tell them that we're here for them. But I have to look after myself too. I'm really struggling with that, and I really hope that the government will send us more PPE. I know the whole 3M thing with Trump has been devastating to hear. I'm really hoping that we step up to the plate and we can start making our own N95s So that's kind of the negative feeling that I'm feeling towards this. On a positive note, I've been overwhelmed by the community response for healthcare providers, especially my own friends. Everyone has reached out to me asking if I'm okay. I even have a friend tomorrow who's dropping off food on my front porch for me, which is amazing. Thank you so much to everyone that's been showing me all the love. And also all these different companies, like Bauer's making face shields now, and all these different companies are stepping up to the plate and making this medical equipment that they normally didn't make before. Even you can see the restaurants are offering discounts for healthcare workers or offering free coffee, which is awesome. So that's what we live off of. But, you know, it's sad to me that I'm seeing such an overwhelming community response, but we're not getting the same response from our own government, who is supposed to be here to help us. But it's disappointing, but I'm so grateful for everyone that's been making even those headbands with the buttons on them for people with the masks, and like offering to make masks and all this different stuff. The community response has been amazing. Kind of like restoring faith in humanity a little bit. That we're, you know, there's lots of good people out there.
Yay, this is good to hear. Also, bad to hear about the other stuff, but thank you very much for doing this.
No problem.
I know it's a little bit nerve-wracking to get on camera, but
it is.
Hopefully people can watch this. Yeah. All right, thanks so much for watching. If you've made it this far into the video, make sure you click the like button, and if you haven't already, go ahead and hit the subscribe and bell notification icon so that when I do put out the next video, which will be like next week or something, you'll get notified. My last ask is to make sure that you get outside. I know everyone's staying safe at home, and I'm not saying anything different, but I am saying as long as you do it safely, maybe make sure you don't get some cabin fever, because otherwise you might go a little bit crazy.